Hey friends, you are listening to episode 420 of Better Than Before Breast Cancer. I'm your host, Laura Lummer, and I have a special treat for you today. So I have two guests on today's show. I want to start off by telling you a little bit about them and why I invited them to speak on the show today. So one of the two is a client of mine. Her name is Cheri Henderson. She's been a client of mine since 2020. Cheri makes her home in Duluth, Minnesota, where she's lived for the past 28 years with her adventure partner, Brent, along the stunning shores of Lake Superior. She's a two-time breast cancer thriver. So Cheri was first diagnosed with invasive ductal carcinoma stage 3 in 2019, and then with metastatic breast cancer in 2021. But she continues to live with strength and joy and purpose. She's active. She has an outdoor-centered life, and she finds peace and inspiration in camping and fishing and traveling and exploring the natural world. She collects rocks, capturing her surroundings through photography, and she nurtures really deep connections with her friends and family. Cheri is also a published writer, and her work has appeared multiple times in the Wildfire Journal, which I'll link to in the show notes for this episode. It is the only literary magazine created for and by those who were quote unquote too young for breast cancer. Cheri has a BA in English from the University of Minnesota Duluth and a master's in communicating arts from the University of Wisconsin Superior. She is amazing. Cheri is amazing. And she has been through some absolute hell with her treatments, which brought us around to this episode, which I'll get to in a minute. First, I want to introduce you to our second guest. Her name is Monica Kasari-Desulme. Monica is a physical therapist. She works in physical therapy and cancer rehabilitation. She has a master's degree from the College of St. Scholastica in Duluth, Minnesota. And she is an incredible wealth of knowledge. So the reason that I invited these women to come and share what you're about to hear on today's episode is because while Cheri was going through some of her hell, which included surgery and very invasive therapies for metastatic breast cancer, Monica stepped in. Cheri found her, and Monica supported her so much through physical therapy. And in doing so, helped relieve Cheri, as you're going to hear. I don't want to get too much into her story because you're going to hear it, but literally changed her life. The pain that she was enduring, the suffering that she was enduring was completely changed and relieved by the work that she did with Monica. And I wanted to share the Cheri story and Monica's insights with you because I think that physical therapy is very underestimated, and that we might think about it after a mastectomy, after some kind of an invasive surgery that we have for breast cancer treatment, just to get movement back and range of motion into that shoulder or something like that. But physical therapy is so vitally important. And honestly, it's helped me a lot throughout the years. I've been to physical therapy on a couple of different occasions for lymphedema and for surgery recovery. But when you listen to Monica talk on this show and the depth that she goes into about how we can find not only relief, but how physical therapy, especially after we've had treatments that have impacted our upper torso, and how the impact on that upper torso can affect so many other things in our health, even including our digestion that we may not know or even think about. And Monica's going to share some of her insights in here on how what's happening in our body, which is all connected, right? Nothing in our body happens in a vacuum or happens in a silo. Everything affects everything else. And so you're going to hear Cheri's story, and you're going to hear from Monica and how they work together and how physical therapy can support a body in the process of healing. And honestly, I think it's a remarkable conversation. This episode is longer than my normal episodes. And honestly, it could have been twice as long because Monica is amazing and I could listen to her forever. Cheri is amazing and I could listen to her insights forever. She's such an inspiration. So without further ado, I'm going to let you get straight into this episode and listen to these two remarkable women and the story they have to share. So, welcome, Cheri and Monica. I'm so glad to have you here on the Better Than Before Breast Cancer podcast. How you ladies doing today?
Very good, very good. Nice to be here.
So good to
Same
have
thing.
you. So, as I was saying in the introduction, the reason I wanted to share this podcast and record this podcast is because I know how much physical therapy can help people. It can be so beneficial. And I know also when we get into the system, when we have a breast cancer diagnosis, there's a lot of information and services that sometimes we just never hear about, and we don't even understand how much they can help us. And so I know I've had help, but I want Cheri to share her story. All right. I want to hear about like what you went through that led you to Monica and what came of that. And then I have a million questions for you, Monica, when it comes to that too, and how this all works. So Cheri, I'm going to hand it over to you and let's just hear what got you into physical therapy.
Thanks, Laura. I'm so excited to be talking with both of you, having you in the same room. It's like, for me, I mean, both of you are part of my treatment plan. So this is like
Right.
the
That's right.
opportunity to have both of you, Laura, you healed my mindset, and
Hmm.
then Monica, you healed my body. So it's like having, everything in one space, which is just amazing as I've thought about, what we're talking about today.
So cool.
But so I guess I could start with I was diagnosed at 39 with stage 3 invasive ductal carcinoma. And then again at 41 with stage 4 metastatic breast cancer. And I came to Monica in the middle, I think in the summer of 2022. And this was after double mastectomies, multiple surgeries. I had 3 rib surgeries that really, really affected my chest, and adhesions and scar tissue. And I had been through, chemotherapy, obviously radiation, so many cancer treatments that affected my body. And I didn't know that I could feel differently or better than how I was feeling. So I thought this was my new normal. With all the surgeries I had, chronic pain. I was at a point where I couldn't breathe without pain.
Ah,
Um, and it was like I was at my wit's end because I didn't know, I'd taken all the drugs, and it was this every day, every moment, like brick wall of a torso that I had. And I just didn't know that it could be different. And so I went to my doctor with just so, at my wit's end. And I had remembered that occupational therapy had helped me so much when I had my double mastectomy, with getting my range of motion back and being able to, raise my hands and, lift glasses out of the cabinet. And so I asked my doctor, I'm like, I need some help. Medication isn't working. And
hmm.
so they referred me to occupational therapy, which thankfully referred me to Monica, who's in physical therapy, because I wouldn't have found her otherwise. So I walk in, on day 1 with Monica, and she changed my life.
Awesome.
I mean, there's things like, I'm getting emotional about it, but I couldn't breathe. I couldn't walk. Um,
Hmm.
I couldn't sit in a car without constant pain. Um, the jarring of, the potholes, or the jarring of my footsteps on the road, would hit my, the places that I've had surgery, and I just couldn't function. And she taught me how to walk again, and sit in a car and breathe. And it changed my life.
Amazing. Amazing. And did you have lymphedema in the chest at the same time too, Cheri? Was there a fluid accumulation there?
Yes, that was part of it too, is when I first saw Monica, it was for that, for the pain and everything like that. And then of course, as time goes on, as cancer progressed, I started a new chemotherapy, which was in HER2,
Mhm.
months later. So then as I'm in physical therapy with Monica, we're discovering all these things that are happening for the first time together. Like, I did get lymphedema in my torso. Whenever I would get the chemotherapy, my torso would swell. and my stomach would swell. And I didn't realize at the time that my lymph system was so messed up from all the surgeries and the cutting and everything that it was like a clogged drain. And I didn't know that I needed help getting that, getting that movement in my body. And so we kind of shifted. So Monica, we did, all of the lymphatic drainage and everything like that. It shifted from, working on pain to helping with the drainage to help with the lymphedema in the torso. And that helped move the chemo through my body faster. And so I felt better. And there are
Awesome.
times when, with the side effects from the chemotherapy, it wasn't, is still intense nausea. And I can go into physical therapy with Monica with, at the time it was like a 10 or 11 on the pain scale of nausea. And she would take it down by half
Wow.
just by doing the lymphatic drainage. And that, I mean, that helped more than any drug that I had.
Amazing. So, Monica and Cheri, thank you so much for sharing all of that. And you know what? It's
Thank you,
so
Cheri.
dang powerful. And things that people things I would never think about. Like I wouldn't think nausea, let me go get physical therapy and see if that helps, right? I think typically we think pain, surgery, injury, right? So Monica, why does that work? How was Cheri able to go after these surgeries? How do you teach someone? What does it mean to how do you teach them to sit differently so there's no pain? And like, why does this work?
Yeah, so well, first of all, I have to tell you that this woman over here, she's an amazing human being in every way, and it's been a journey for both of us, actually. I have learned so much from her, just interchanging information and just life in general. And so it encompasses it all, right? And I think that's what we miss a lot of the times. We compartmentalize the body on different parts of it, and it all works together. And I think when we start looking at the body as a system, we start understanding that it's all intertwined. And then we can make pathways, literally speaking here. But yeah, so I met Cheri through her occupational therapist, like she said. And she was actually seeing her because of the pain and the myofascial restrictions. And they were working on the shoulder, but her occupational therapist told me, there's more to it than just the shoulder. I don't know what else I can do. And I do have a background on chronic pain and lymphedema, MLD, and cancer rehab. So she said, is there anything that you can think of? So when we first met, I realized it wasn't just the shoulder, but the whole thorax and torso was full of adhesions and scar tissue. And obviously, she was deconditioned because she couldn't move posturally. She was protecting. So she was
Mhm.
all shorted on the front. So we have to start working with the soft tissue, the diaphragm, trying to move. And then after that, we realized that you have to move this body against gravity. And when you haven't been doing that for a while, you are weak. So you have to be able to strengthen. And she did an amazing job. She's like, everything that you tell her to do, she does everything and more. And she was doing amazing. She was exercising. She was doing planks. And
Good
then
job.
I know, I was like, oh my goodness. And as a therapist, you get very excited when you get a patient that does everything and she's happy
Yes.
about doing it and she has all this insight. And so I was, with her together, we were learning about different things, but we had to like work on core pelvic stabilization, pelvic floor stabilization, postural strengthening, posterior strengthening, anterior stretching. And then we
This is so I'm going to ask you something. I want to stop before we get too far. Like
Sure.
that right there, what you just said is amazing because here this woman says, I had surgery on my breasts, I had surgery on my ribs, and you're saying pelvic floor, right? And so I think that this is like, who would ever think, because we don't think about that kinetic chain and all the connections for the body.
Absolutely.
So I'd love to hear. So you said something a second ago about scar tissue and adhesions. Can you just help for people who may not understand that? What is an adhesion and how does that happen inside of us and what can it result in?
Mhm. Well, now we know I'm going to talk a little bit more from a cancer perspective, because, we get adhesion from different issues, but we do develop anytime you will do surgery or you cut through connective tissue and soft tissue, you will develop adhesions. And when we are talking about the chest area, the adhesions on the scar tissue could also go into the visceral area as well. So like I do see people that they have adhesions on the abdominal cavity and the whole intestinal tract gets involved because the adhesions attach to the wall of the intestinal tract and GI tract, and then they decrease the motility of your intestinal tract, and therefore you will have issues with constipation and it restricts mobility of the bowel movement. In
So
terms
let me
of
just ask you a question. Sorry to interrupt you, but you're
Sure.
fascinating me. Okay, so I could have a mastectomy or multiple surgeries in the chest, reconstruction, and it could cause an adhesion that changes the way my digestion works, the intestinal tract.
Absolutely. Yes,
And so what
absolutely.
is an adhesion? Is it one tissue sticking to another tissue? Is that why
Yeah,
it causes a problem?
sometimes I describe it. I mean, that's part of the fascial system, but when you peel a chicken, for instance, you have that clear it's all connective tissue of different densities. That's what it is, right? So when you have a scar, it's going to be connective tissue that is not organized. So it's tough and hard, doesn't have the elasticity that normal tissue has. So anytime that you have an insult to your system, such as even if it's surgical or, an accident, whatever it is. So your body is going to produce, those adhesions and scar tissue. Some people more than others.
Okay.
So it varies from person to person. But,
Mm-hmm.
but for instance, I mean, the role of the diaphragm, for instance, right? So that the movement of the diaphragm is one of the most important things in terms of breathing, right? That's the first thing we do when we are born, and that's going to help with the vascular system and the lymphatic system. So when your diaphragm is tight because you have scar tissue from all the things that happen on the rib cage area, or it has become tight because you've been protecting, or it has become tight because your nervous system has gone through so much that it's into the fight and flight mechanism. So now we're talking about the nervous system and the sympathetic nervous system. So that's going to all affect all the organs and also the diaphragm and also the soft tissue. So what all that does is to decrease movement, circulation, lymphatic flow. And as those systems become sluggish, it's going to impact everything. Now we know there is connections of the lymphatic system to the nervous system, to the glymphatic system, which is the lymphatic system in your brain. So when you go through something like chemotherapy, that is going through the whole system, it's going to affect everything that is, which is kind of the goal of the chemotherapy, correct? You are trying to
Yeah.
get all those bad cells and, get rid of them, but it's also affecting the whole system at the same time.
Yeah. And this would
So,
be IV chemotherapy or oral chemotherapy, right?
oh
Anything
yes,
that's having
anything
an
that is
impact.
going to go through your system.
Mm-hmm.
Yeah.
Mm-hmm.
So I think, well, once we knew that Cheri was going to be going through, in Herdu, and going through chemotherapy, and she was having all the symptoms of, significant nausea and headaches and fatigue. Um, we knew that we had to move things. And it's really sad that, you know, we have all these physical therapists, but we're not really doing that with patients with cancer. We're doing cancer rehabilitation, but we're not doing necessarily any type of manual lymph drainage for post chemotherapy, or not, at least not so much here in Duluth. I mean, we do manual lymph drainage if someone has developed lymphedema after, for instance, you know, a mastectomy, and they have the one arm that is, you know, there's lymphedema, then we do that. Or sometimes we do post breast cancer, if they do have swelling on the breast area, or if they are developing a cording, you know, we do that. But we, as far as I know, I don't know any therapist that it's doing lymphedema to address the lymphatic sluggishness post chemotherapy. I think they do in other places, but I'm not aware that we do that as a protocol anyways in Duluth. But one of her main complaints was a lot of nausea. It doesn't take too much to think, well, you know, you have this whole you know, I call it toxicity from chemotherapy. And although we want that to do its job, we want it to get out of your system ASAP. And if your system has gone through so much already and it's having to do this every 4 weeks or 3 weeks at first, and 4 and 5 weeks, you know, it needs a little help.
Yeah.
I think that was the idea of starting to do lymphedema, manual lymph drainage. But then as she developed headaches and issues with her, you know, with headaches, I thought, well, I do cranial therapy. We know that now it's fairly new, but we know that we have a system called glymphatics. They're a little bit different from the lymphatic system because the glymphatics are part of the vessel system versus in the case of the lymphatics in the body, they are separate. You have the venous system, the arterial system, and the lymphatic system. But in the brain, the lymphatic system is part of the vascular system. But the main role of the lymphatic system is again to clear toxicity and then to clean all the toxins and byproducts of dead cells, especially during the night, during the REM part of your sleep. So if we can assist the movement of the way it works, you have the spinal fluid, and then that is going to be dumped into the interstitial fluid, and that's kind of what the craniosacral treatment does. So if we can help the lymphatic to move into the interstitial fluid faster, then we can get it rid of through urination. So that
Would that impact chemo brain? Like when people say,
yeah, because that's what chemo brain is. Chemo brain is just the flooding of all these toxins that they're you know, staying in your brain and creating this issue. So then if you speed up, you know, the flow of this and just get it out of the lymphatic system is very important. I mean, there's not a lot of studies yet. I mean, for sure, sleeping, right? Sleeping, especially between the hours of 11 and 2 o'clock in the morning. That's where generally REM happens. Although it's different for people. It's very important because that's when we are cleaning up and flushing the brain, because that's the time that the cerebrospinal fluid opens up its channels to be cleaned out. And then
so let's just repeat, let's emphasize that for all you listening who are scrolling your phone until 12 o'clock midnight or 1 o'clock in the morning, right? So your brain is actually cleaning itself from the hours of 10 to 2 if you're asleep.
Correct. Yep. It's that's what the research says right now, from 10 to 2. That's the best time. And that's when you have concussions and things like that. We emphasize to make sure you sleep during those times. But people are different. So, depending on the rhythm of that individual, it might change. But that's why sleep is so important for anything that has to do with your brain, but also with cortisol too, right? With anything that has to do with um, stress hormones. So yeah, sleep is very, very important. It's part of also, the treatment. And then also we're talking about anything that has to do with calming the nervous system down, because it's all intertwined. And research that shows that being, in nature, it does calm the nervous system down. It will decrease cortisol, and then it will increase dopamine, and it will increase serotonin. It will just give you that calmness. It will decrease the amount of rumination that we tend to do too when we are under a lot of stress. So doing all those things, plus adding, cranial therapy, and MLD to be able to, you work that glymphatic system between it's cranial sacral. So we're talking about the whole sacrum, the spine, the cranial, the brain, and then,
And what is MLD? Sorry to interrupt. What is
manual
MLD?
lymph drainage. So
Okay.
it stands for manual lymph drainage. Generally we start proximal, and that's when I was emphasizing the diaphragmatic breathing, and breathing in general, because that's gonna kind of set on the lymphatics. The lymphatic system is different from the vascular system. So for instance, we have to differentiate that, because sometimes they tell you, well, just elevate. Well, elevation has to do more. It does help because the lymphatic and the vascular system are connected to each other, but the lymphatic system is a high protein edema. It's not like the vessels of your legs, the venous system, that they have valves, and when they get inefficient, what if you sit a lot or you stand a lot, and you are older, and the tensile ability of the valve is weak, what happens is that the valve opens, the heart pumps, and you're giving direction to the flow. So if it's your legs, they're far away from the heart, so they have to go against gravity. And when those valves get weak, you will get more swelling. So that's why they tell you to elevate your legs above your heart. Now, if you have congestive heart failure and you have edema, generally it's on both legs, and it has to do more with the fact that the heart is sluggish and it can't pump all that fluid, which is different from lymphedema. So the treatment will be totally different.
Okay.
You not want to be bandaging, and you don't want to be doing a lot of compression. If your heart is already tasked and you do that, then it's going to put more pressure on the heart. But lymphedema is more of a high protein edema. So that's why we have to do the manual lymph drainage. We have to manually push that out. We have to compress it. It's kind of like having the beans that soak on water and they get filled up with fluid, and then we have to put a cheesecloth to be able to push that out, because water is going to go to where the area that there's more concentration of proteins or beans, right? So it tries to normalize that. So you have
What a
to
great analogy. I love that. Yeah.
yeah.
I
So
didn't see
that's
that.
why we use garments. If people are just wondering why do we have to use garments in lymphedema, that's the reason why. We don't have really valves on the lymphatic system. And the concentration of protein makes the water suck into the other side of the membrane, and it will not just go out by elevating your arm or your leg. You have to actually apply compression. You have to apply pressure in order to push the fluid out. And that is why once you have lymphedema, you do have it for life, because the system has gotten to that point, and now it needs the compression in order to stay from, swelling.
Hmm. And why is that? So, well, before I go to that, I have two questions because when I asked you,
Yes.
does this impact chemo brain? Cheri was emphatically nodding her head. She's like, yes, yes. So, Cheri, you notice a big difference when you started to doing the craniosacral therapy and the lymphatic drainage?
Yes, I did. And that was unexpected because we were, I was focusing on getting the fluid out of my torso, but then the amazing, benefit of that also, I noticed each cycle of chemotherapy that I'm on keeps getting better and better and better as we've figured out kind of how to manage this. And with the chemo brain or the brain fog, I noticed right away that there's this difference. Like it's not as heavy or thick as it was, or cloudy as when I had first started with the chemotherapy. It was because it was almost like a physical veil or something that was just settling over me. Um, and I was, more clear in how I was able to speak and find words. And, with the brain, just the mental fatigue of the brain, I felt like was a lot less after doing the cranial sacral and the lymphatic drainage.
Fascinating. And so, Monica, you're saying that's the glymphatic system. That's helping to drain the glymphatic system that helps with that.
That's correct. Yeah.
Okay.
So,
Okay.
so in the body, we call it lymphatic system. And what the lymphatic system does is kind of like the garbage collector, right? So, for instance, well, I don't know if I should be super technical, but why not?
Why not?
Sometimes if you understand it better, it's
Yeah.
more fun, but well, maybe just for me, but But so it all the lymphatic system also helps with the immune system, right? So that's why for those ladies that they have had lymphedema, they tell you make sure that you don't get an infection and you don't develop cellulitis, because once like for instance, if you are camping and you get bit by a mosquito and then you start scratching with dirty fingernails, that area that has been compromised, that right arm, because you have had radiation and then chemotherapy, and they have taken, the lymph nodes on the right arm. What happens is that the lymphatic system is compromised, and therefore it doesn't have the ability to fight infection. So the way the lymphatic system works, there are agents that help with the infection in the fluid, but also they are filtered through the lymph nodes that they tend to conglomerate or in certain areas of your body, like your axillary area for the upper extremities, like the inguinal or the groin for your legs, like the neck, your chest, the deep lymphatics of the abdomen. So in the same way they do that in the body, they also will clean up and clean the toxins in your brain, and that will be the glymphatics. So they have a very important role. Lymphatic system and the lymphatic system is the same. They have the same function. It's just that anatomically they present differently, and one is called the glymphatic in the brain, or the in your head, and then lymphatic in your body.
So I have a question. For me personally, I have active cancer in a lymph node under my arm. I also have lymphedema from the tumor having been under there and other surgeries. Is it safe to do lymphatic drainage when you have cancer in the lymphatic system?
Well, I mean, that's something that generally when we first start treating and you are active cancer, generally they don't want you to do a lot of moving things around, correct? Because you don't want to be spreading things around. Now, if it's a situation where it's been, there for a while and it's not active, then you can do that. However, you don't have to do all in that area. You can still do MLD, not right on the spot, but on the other areas of your body. And your lymphatic system your lymphatic system is still working. So that's still happening regardless. But you're right. I mean, if you have active cancer and you know that, you don't want to spread it. I mean, they don't have true studies that necessarily that will for sure spread. But
Right.
yeah, we were told when we go through certification that, if you have active cancer, you don't want to, necessarily go right there and start doing that.
Okay. Yeah. So for
Things have
instance, like,
changed, however, maybe there's more studies now that's different, but that was a while ago. So
yeah. So even if it were in the lymph node, axillary lymph node, for example, could you massage the arm, the forearm, like gentle lymphatic massage? You just wouldn't want to target an area where you knew there was cancer spot right there, and it
right,
would
yeah,
still help the lymphatic
yeah,
system overall.
yeah.
Okay.
And that is kind of what we do with lymphedema in general. So we try to bypass and create new pathways to the lymph to flow.
Okay.
So if yours is the right axillary area, we try to go into the right inguinal area. So that's how
Okay.
you do the lymphedema. You are not going to try to go into the right axillary area because that's where you are affected. So
Mm-hmm.
you bypass it into the left side and the right inguinal area. So you are going away from it. You are kind of bypassing and creating another pathways for the lymphatics to flow and not
So
necessarily.
essentially, your body is compensating, right? You can teach other parts of the lymphatic
Right,
system
that's
to
correct.
compensate for what's not
Yeah,
working right.
that's
Yeah.
correct. And that's kind of the whole idea of doing manual lymph drainage. You're trying to create new pathways to still move the fluid because you have to move the fluid out of there.
Yeah.
But creating new pathways that could be drained on different channels or different, paths. Mm-hmm.
And what
And
about
I've
for
seen,
people?
oh,
Oh, go ahead. No, go ahead, Cheri.
I was just going to say, and I've seen that actually in action with me, because in the beginning, I couldn't, that fluid wasn't moving without Monica's help. And now my body slowly and over time rebuilding those pathways and getting it stronger and everything too. It's like rerouted and
That's
it's doing things on its own that it didn't do months or years ago. So it's like teaching it, Monica's teaching my body really how to respond and build new pathways. Which, it's still, I still need help with that, but
yeah.
it's like tremendously better than what it was prior. So it's like it's really cool to see what she's talking about actually applied. I mean, in real life, this
Yeah.
happened to me.
Yeah. That is so cool. And you had said in the beginning, like, she taught me how to breathe again. She taught me how to walk. What does that even mean? How do you teach someone how to breathe differently? And why would that
Well,
impact pain? Like you use the term she protected. You use that a couple times. You said you're protecting. What does that mean and how does that impact us?
I think what Monica, and maybe you correct me if I'm wrong, but by protecting, I was, my shoulders were hunched. I was protecting my chest because that was like the most, vulnerable part of my body at that time. So I was like unconsciously even just, you know, crouching forward or hunching forward. I couldn't even straighten my shoulders or put my shoulders back at all before. And so that, that's kind of like protecting. Um,
Mhm.
but then what was the first part of that question, Laura? I'm sorry.
So I was saying, so with you
Oh,
had said she taught me how to breathe again. She taught me how to walk again. So what does that even mean? Like, Monica, how do you like if I came to you, I'm like, I've been 61 years old, I've been breathing this way forever. What does that mean? How can I breathe differently?
Sure. Well, the body is very smart, right? So sometimes a little too smart, maybe.
Mhm.
So it's going to compensate. It's going to, so if generally when you have pain, you don't just stretch all the way out. And, I've seen that very little. Generally, when there is pain, you just kind of shorten, you close, you protect with other parts of your body. You start using other parts of your body because you don't want to use that part of your body. And that starts to create a whole imbalance in every level. So, so there are, of course, as a therapist, you see injury, you see restrictions, um, and they're true restrictions. So sometimes you can't, but there are good ways to compensate, and there are not so good ways to compensate. Sometimes we compensate a little too much. And sometimes the compensation is not because of the physiological or the soft tissue. I mean, there are cases like complex regional syndrome. You know, you don't even touch the person. You just put the hand close by and they have tremendous pain. You know,
Wow.
you know
Wow.
that is not a physiological pain. You haven't touched the person.
Yeah.
So that's a neurological, it's your sympathetic nervous system. It's the nervous system just in high gear. Now, I tell my patients there is muscle tension and there is compensation or protective tension. I can help with the muscle tension, but the hypersensitivity of the nerve, the tension from guarding, you've got to help me because it's your nerves. We have to breathe. We have to tap into the parasympathetic nervous system, the relaxation, the feeling good, the letting go. And that includes the digestive system. For those of you that they have a lot of hypersensitive nerves or your system is always heightened and you have a lot of digestive issues, the sympathetic nervous system affects circulation flow to all those organs as well. And that's why you got gastritis, you got, tummy pain, you got motility issues and bowel movement issues. So how do you work on that tension that comes from the nervous system? A lot is education. So the patient knows, oh yeah, I'm not even touching that. So it's your protective mechanism, so it's okay. I'm not injuring anything here by doing this.
Mm-hmm.
The other thing is just breathing and starting to be able to relax. And like I said, just exercising, going out, trying to relax your mind because everything starts there. So when
Yes,
you
it does.
right, right. So we ruminate, we get anxious, we are worried. Every pain that we have, oh, that it's cancer back again. I mean, and if we think that doesn't do anything to our system, let's think again. Chemicals are flowing, cortisol is going up, circulation is decreasing, the lymphatic system is, going weak. So it's very important to start with, we need to do that part too. And that part I can't do other than educate you. That part has to be done by the patient. So to have the knowledge and then to be able to stop yourself when you're ruminating and say, oops, I'm doing this again. Okay, let's take a deep breath and let's think about something that makes me feel good, whatever that is. Or, oop, I'm holding my shoulders up again. Okay, I'm going to take a deep breath and I'm going to cut that cycle. So then
I'm finding myself taking deeper breaths as she's talking too. Like, am I sitting up straight?
yeah. So
Me
I
too.
think a lot is that awareness and we get good at those things that we do the most. So if we are always protecting, always worried, always anxious, we're going to get really good at that and we get trapped in this cycle. But if we are aware of that and we can cut the cycle right there, because now we have the awareness, we can slowly change that cycle. And suddenly now we're walking upright, we're breathing, we're relaxing, enjoying, feeling more in our body. And, we changed all that. And now we don't even remember that we had those problems.
That's awesome. Yeah. So,
Yeah.
Cheri, when you go to see Monica, you leave not only with some, I'm imagining, physical practices that you need to do to support that retraining of your body, but you're leaving also with mental and emotional practices to support it energetically as well.
That's so true. And it's nothing that I ever, I think I said earlier too, it's like I don't know what I don't know. And so like this sounds like common sense, but when you're applying it, when you ask me like how does she help you breathe again? Or what does it feel like? It just for me it was I was breathing so short and shallow and I was not breathing fully into my diaphragm, into my stomach even. And there was so much pain that I couldn't. So then I was continuing to breathe in this just really short manner. which doesn't help my overall body anyway. But I didn't
Okay.
know that it could be different. Like I
Yeah.
didn't know that like, oh, I'm going to go to physical therapy and I'm going to, all these wonderful things are going to happen. It was just starting out really small and then it kind of cascaded down from there too. It's like Monica then helped me like realize that I was even breathing short and shallow. I didn't even realize I was doing that. Or like I didn't realize that I was standing with my shoulders hunched. Or when I walk, like I was like slapping my feet on the ground. It was so funny. The first time I met Monica, she told me to walk away from her and then walk back towards her. So I did, and then she mimicked my walk back to me. And it like she was slapping her feet on the ground and she's like, no wonder all of the pain that you have gets exacerbated by the movement and the slapping on the ground or in a car with the potholes and stuff. It's hitting all those sensitive areas because you're not bracing your body, or you're not, if you stand on, put energy in your toes and in your feet, like you can actually walk in a more, less jostly way. And that was the first thing that, led me to where I am now. It's like, or in a car, or, when you're sitting in the car, you brace yourself with your legs and your feet on the floor mat of the car so that you are supporting your rib cage and your torso. If you have, surgical pain in your chest or wherever. But so like doing that and activating my leg muscles like that made it so much more comfortable for me to ride in a car because I couldn't do that before more than like 5 or 10 minutes. And now I can sit in the car for like 10 hours, which I wasn't able to do prior. Just, all of these things that, the pain you think that you get used to, or that you think, you can't see beyond it because you're like, okay, this is just how it is for me now, or my new normal or something, because that's what they tell you.
Yeah.
But with this, there's a whole new way to live.
Awesome.
And I didn't go in, with that intent, but I came out of it with that. It was, that's why I say it's life changing because it's not just about my body, it's about my mind. It's about my, my emotions, my mental state, everything. So it just, it gets me back to being the physical, active person that I was before cancer because we, my partner Brent and I, we go into the boundary waters. I ran marathons before I got cancer. And so there's active lifestyle was always part of my identity, part of who I am. And then with cancer and cancer treatment, I had to, figure out what that looked like again. And so going to physical therapy brought back those things. And I'm able, I went backpacking. We went backpacking in the Rockies and in the Grand Canyon this year. And
Amazing.
I'm going into the boundary waters for the first time again next weekend. And these are things I'm able to do because of all that, stacking each, successes with the physical therapy, with working on, the body and the mind and things like that. It's incredible what space has opened up from physical therapy and how this isn't like the magic wonder prescription that everybody gets, when they have they don't even need a cancer diagnosis. It's for absolutely everything.
Right. That's so awesome. And Monica, that's got to help you feel good. I mean, and because Cheri, and not just the big, like going into the boundary waters and hiking and camping, but I can remember when you couldn't drive to see your mom. Right. And so because we're in pain and we don't know that there are other options out there and things that can support us, we start to make our life smaller and smaller to accommodate what we're told is this new normal instead of, which I love what you said, why is this not a part of everybody's team? Right. Why, as soon as you get a cancer diagnosis, do you not get a physical therapist, a nutritionist, a mindset coach? Like, why don't we have this team? Because it needs a team. Right. So
I
important.
agree. I don't like that phrase. This is your new you. What does that
No,
mean?
I don't either. Yeah.
Really.
Sorry, but that's a bullshit right there. Yeah. Nobody take that. No, that's bullshit.
Right,
No,
because
I
it's
mean,
limiting.
it's just been amazing in every way. I mean, you can teach and do those things, but I mean, she just took it all in and went for it. And she's one of the people that all these things keep happening to her, and she just keeps, going through it, persevering, overcoming it, and then coming on the other side better than when she got all these awful things happen. So,
So true.
I mean,
So true.
that's also the reason why, I mean, you can teach them
Absolutely.
things and do that stuff, but it's that individual, the strength that she has, and just the love for life,
Yeah. And we
It's been
have
a
to do the
pleasure to
work.
work with her.
Always. Yes, always. And, I think that's such an important thing, though, right? You have to do the work, the mental work, the physical work. Cheri, I know that on all levels, I know that when you came home, the exercises you had to do were not comfortable. It didn't feel good to do those when you got home. It doesn't feel good to do the emotional work and deal with the stuff that comes up to change the mindset. And this is something that, I work with my clients all the time, right? And they'll say, "This is hard." Yes. Can we just say that out loud? Yes, it is hard.
Yes.
And we have to get the support we need, and we have to love ourselves enough, and we have to say, this is not going to be easy. How do I set myself up for success? What support do I need? Because it's not easy. Right. And I wish it was. I wish there was an easy button, but we really had to be committed. And sometimes it's physically and emotionally uncomfortable to heal a life and a body. It just is. And Monica, I wonder, so obviously when people go through breast cancer surgery, I think just about everybody has at least a sentinel lymph node removed. There's like going to always be some kind of invasion of the lymphatic system.
Mm-hmm.
And oftentimes, my clients are intimidated by exercise because they're afraid to get lymphedema. And so, could you address that? Is it dangerous to exercise if you've had a lymph node removed? And should people be afraid of exercising, or is that a myth?
Yeah, so with lymphedema, I mean, I have seen people that they had just a lumpectomy with a sentinel node biopsy and they developed it. And I have people that they had a mastectomy, radical mastectomy, radiation, and lymph nodes taken out and they didn't develop it.
Yeah.
So some people have a lot of lymph nodes, some people have very few, and some people don't have any. But that's not, the people that we are talking about. But so it depends on all those things. However, exercise actually will improve all of that. The only thing that I will say though, if you do have lymphedema, when you exercise, you are increasing vascular flow. Therefore, because like we talked about before, it's a high protein edema, it has to have the compression. So if you do already have lymphedema in your arm and you're going to exercise, you have to have your sleeve on. Because as you have the sleeve on and you exercise against the pressure of the sleeve, you will have very good lymphatic drainage. However, if you don't have the sleeve and you exercise a lot and you are having a lot of vascular flows through your system, but there's nothing the cheesecloth is not there, then it will swell more. So if you do have lymphedema, especially higher stages, you have to have some kind of compression when you exercise in order to maintain that drainage. Otherwise, it will fill up.
So if you've had a lymph node removed and you do not have lymphedema, but you do exercise, is there any benefit in wearing a compression sleeve from a preventative perspective?
We generally don't do that for preventative if you don't have lymphedema. The
Okay.
only time that we have maybe said, maybe just in case, so you don't go over the threshold, if it's underlying and dormant and we just don't know it is if you fly for a long period of time, not 2-3 hours, but if it's like a 4-5-6 hours up in the air because there's no atmospheric pressure. So even those of us that we don't have lymphedema, we will swell a bit in, when we're up in the air, especially if we're out there for a long time. So if you don't have lymphedema, but you're not sure, and then you're gonna go to, Japan or something like that, probably it would be a good idea to have a sleeve, just in case. That will be the only time I think that I will. But for exercising, it should be okay. I mean, you can, you can't generalize with things like that. You can see how it goes. If you
Yeah.
exercise and you're fine, then you're okay. I mean, you exercise and now your arm feels heavy and thick and feels kind of different. Maybe you want to keep an eye on it, survey it, and from that.
And
So
that's what I
wait,
do. So I was
no, go
going to say
ahead.
that's what I do. For me, I wear compression tanks when I do like rigorous hiking or go on walks, or when we're in the boundary waters where I'm canoeing or fishing. I have a compression tank that starts right underneath my arm and goes all the way down to my stomach, and that holds my torso in. So, like Monica was saying too, like when I'm doing these like really physical activities, it's holding everything, it's stabilizing my rib cage and torso too, but doing all the good things that she was just saying as well. So, while I don't wear a sleeve, I only wear a sleeve when I travel and fly because I don't have lymphedema in my arm at this time. But the compression tanks, they make such a difference for me, especially when I'm in heat.
Yeah.
When it's warm out and everything, it's like everything kind of swells a little bit when it's hot, in the summer and humidity in Minnesota, things like that. So, the compression tanks I've found really help me.
Awesome. What a great tip. We'll have to put a link to where you get your compression tanks in the show notes. Yeah, that's really interesting.
Generally, I
So,
think that people that do have lymphedema find compression actually more comfortable than not.
for
Unless
sure,
it's
I
like
do.
super hot and humid, then that's hard. But generally, if they do have lymphedema, I think most of the time I hear they like that compression, than otherwise.
Yeah, I agree. It's like sometimes you get because it's irritating, like in the elbow crease. And so I'll just like rip it off. But within half an hour, I feel this weight on my shoulder, right? I can just feel the arm getting heavier and it's uncomfortable. And when I put the compression sleeve back on, it helps to lighten that. Absolutely. Yeah. So what do you think? I'd love to get your insight for people who are listening and are in chemotherapy. If you could recommend a protocol that you think would be helpful to support someone in chemotherapy, would it be how soon after a treatment would you get physical therapy just to keep things moving?
Yeah, and that's what we have been doing with Cheri. That's not generally the normal protocol that we see most of the time. But patients can request that. And you just have to find a physical therapist that is certified in MLD that is willing to do that. And the people that I have seen to do that, they have all benefit from it. Most of the people don't do that. Part of it is because, insurance or the the way the oncologist or the cancer rehab team, they just don't offer it. So a lot of the times it has been that the patient had to request it.
Okay.
Yeah, and then that there is a therapist that it's willing to do that and is able to do it. That knows how to do that. Yeah.
So they would look for a MLD
Yeah.
specialist
Yeah.
in
Yeah. A
in
certified
physical
manual.
therapy or occupational therapy. Do both of them?
Yes, occupational therapists do that as
Okay.
well.
Okay.
So there are OTs and PTs that they're certified on manual lymph drainage. And if there is someone that does visceral manipulation in conjunction with myofascial release, in conjunction with cranial craniosacral, that would be great, because then you're covering every area there.
We need to get Monica on an airplane and just fly her around the world working on people. Yeah.
Right? I
Yeah.
mean,
If you live in Duluth, you guys are lucky. But if not, you got to get her to move to you.
Yeah, and I'm sure that there's more and more, therapists doing that now that we are understanding how it's all intertwined. So I'm hoping that we'll be there, soon.
I love that.
oh
And
yeah.
what
And for me, I was just going to say really quickly too, just to help with showing like what a schedule looks like. I get chemotherapy on a Monday, and then I go in and see Monica on Tuesdays and Thursdays. So like directly the day, not the day of, but the day after is when I see Monica for the lymphatic drainage. And then I get extra fluids and steroids and anti-nausea meds on that Thursday. And then after that, my torso tends to, puff out just a little bit and get a little swollen from, although that's gotten a lot less and less too over time. But then I see Monica in the afternoon. So it's like, so Tuesdays, Thursdays, so usually twice a week is when I see Monica for, each week. And then as I get further away from chemotherapy, we can kind of address some of the other issues, like whether that's the headache or, different things like that, like the fascial release of like the torso and things. So it's like, we kind of, we address the chemotherapy until it's all fully out of the system, and then we can address the other things too. So, and what I also do when I don't see Monica on my off days, I step on the vibration platform, because that also stimulates the lymphatic drainage. So when I get home from chemotherapy, actually, that's one of the first things that I do now is just to I stand on there. I just do 5 minutes at a time. But because I want to still, be gentle and everything with my body that day. And so I stand on there for 5 minutes, and then I try and go for a walk just to get everything moving so that I'm prepped and kind of ready when I see Monica on that Tuesday. And then she can really deeply address the other, the lymphatic drainage and things like that.
Love it. Yeah. Monica, do you think, in your professional opinion, vibration plates, which I use one, I mean, I know it's like I love them. Do you think it's helpful for people to use those on a regular basis? What are your thoughts on those?
Well, it seems to me like anything that addresses stimulating the lymphatics, there's going to be a positive effect. It could be jumping on a trampoline. It can be jumping on a ball, but not jumping, but, bouncing on a ball, with deep breathing, with the breathing component. But like Cheri said, right after chemo, sometimes all that is a little too rough to do.
Sure.
So maybe like the vibration platform is a little, gentler to start with. Or even, that, and then the breathing. I think the breathing is very important no matter what. I mean, that's one of the first things we teach as manual lymph drainage therapists, is to do diaphragmatic breathing. And just to start, when you do that, you also start to stimulate the inguinal and the axillary nodes as well. So things start to move.
Awesome.
So breathing is very, very important. Yeah.
Yes.
For
So
everything
good to
that
hear.
we do.
Yeah. And one more question, because I could talk to you all day, and I know I have to let you get back to your life. But I'm just curious, like for people who have lymphedema and they've had it for a long time, is there anybody that couldn't be helped if they wanted to go get some physical therapy, if they had, swelling wherever, if they've been dealing with lymphedema for a long time?
Yes. Obviously, it's so nice that now, we have prehab even, meaning that we are educating, like at Essentia, we have, prehab. Not everybody, but some of the surgeons or the doctors do that, which is great, where we are teaching them how to survey it, as we give them, the exercises to do after the mastectomy or the lumpectomy, and also what kind of exercises, what kind of things to survey in terms of like lymphedema, but also cording. And then we also measure pre-surgery. So we know what the baseline is for possibility of lymphedema in the future. So that's really nice to be able to have that. However, I have also seen patients that, they didn't have any of that many years ago. And obviously, when it's post 20 years, of surgery and lymphedema, and then nobody really understood lymphedema, and this patient will be complaining about swelling, but they didn't know what it was. So now they're all fibrotic, So once fibrosis sits on, it's a whole different ball game. But it's still possible, I believe. You have to do more bandaging to be able to break down the fibrosis with different types of foam, probably some with different types of density of foam to be able to break that down. So it's not just swelling at this point. Now we're talking, break down the fibrosis, and there's already keratosis and skin changes, and it's much more involved, but it's still possible. I've seen it where they still can soften, they still can, get smaller, and then they have to wear the compression. But it's hardest sometimes is when they are so full of adhesions and scar tissue in the chest area that is just really hard to, even manually release that. So the outcome when it's like 20, 30, 40 years of post, bilateral mastectomies that they never were addressed, that will be a little difficult. But when it comes to lymphedema, I mean, it's still possible. You still can decrease the fibrosis. It's a process, but you can soften the fibrosis and then decrease that and then manage it better. Because like I said, when you continue to have lymphedema to that degree, the main thing about lymphedema, is the cellulitis. Once you get cellulitis, once you get it once, it goes up exponentially the amount of times that you get it. So you do want to address it to prevent any kind of, disposition to infection.
And it doesn't take much, right? So I had cellulitis, and it was from literally like walked by like a aloe vera plant, and the tip poked me on the arm. And the next morning, I had a purple, bumpy, swollen, excruciatingly painful arm. Like cellulitis is no joke,
Yeah.
right? And so anytime I'm around anything that might scratch, I wear this 24/7 anyway, but I'm like super careful to protect that arm, right? Cellulitis is scary.
Yeah. I will say that's the only one scary thing about, sometimes you see these big arms and people get kind of scared, but that can be treated. That can be reduced, that can be treated. I will say cellulitis is probably the most dangerous side effect of lymphedema.
Yeah. So is there anything that I haven't asked you that you would like people who've been through breast cancer surgery and treatment to know that they could do for themselves, whether it's from lymphatic drainage or pain management or movement or functionality or anything? What would you like them to know is available?
Well, I will say, like I said before, I mean, there is cancer rehabilitation. It's been 10 years now, maybe, or 8 years. There was a big push for that. So a lot of different big systems in the United States, I mean, we have to go through quite a hefty studying of, different types of cancer. And a lot of us, we have gotten certified on that to be able to treat cancer rehabilitation. So as therapists that we've been certified on that, we are, there are quite a few of us, but there hasn't been a lot of referrals, I guess. I'm not sure why. Because we have educated, the oncologists, the surgeons, but there's, and even the patients, sometimes, when you're going through the whole cancer journey, when you're going through that, cancer rehab is not in the forefront of your mind. I mean, that is not the most important thing. You're trying to figure out, what's going to happen, what kind of surgery. I mean, is it going to be chemo? Is it going to be radiation? So and, so that's not in the forefront. But generally what people suffer the most afterwards are the consequences of not necessarily the cancer, but the cancer treatment.
Sure.
So they have the ability to advocate for themselves and say, you know what, I have these problems and this is now my new me and I'm just gonna live with this. There are, ways to overcome that, that they're not invasive, a lot of them, they're not even invasive. Um, so it's good to do that, I think, to advocate for yourself and then ask questions. Hopefully, there are people that they can do that close to you, or there should be. Like I said, there's a lot of us that we got certified on that. So, but again, if we don't utilize those skills because there's no referrals, we kind of lost it too.
Right.
Yeah.
So, but
So
I
even if
would
it's
say,
not on the forefront of your mind, know that this information, that it could make it a less miserable experience if
yes.
you're doing it, right?
Yes,
Yeah, it
like
could
you
really
don't
help you.
have to necessarily live with all those symptoms that you thought that there was no other way out. There are ways out. I'm not saying that always, but most of the time you can, and most of the time is something that you can do, uh,
Mm-hmm.
and it really makes your quality of life much better. Or at
Yeah.
least knowing those things, it calms your mind. You won't be thinking, oh my goodness, cancer is back again. Maybe it's something else related to the cancer treatment. And so that alone, it just improves the way you think, or take away those panicky attacks, that, oh my gosh, is that cancer again now? Or at least you have someone, as physical therapists, we have a little more time than the doctor. So, we're able to kind of talk through those things a little bit more and be an advocate for you as well. So yeah, use us.
Yes, use them for sure. I love
And I
it.
Mhm.
talk,
Well,
I talk about Monica all the time, whether it's with my oncologist or, whichever doctor I'm with, like to make it known that she's part of my treatment plan, that physical therapy is part of the plan. Like that's a non-negotiable. So whether that, they have to figure it out to code it correctly for insurance, or, to get the referral in the first place, it's really, the more I talk about it with all my different teams and everything, like the more they're understanding, and acknowledging that, yeah, it is part of, my oncologist now totally gets that physical therapy is part of my plan. And I talk to the infusion nurses every time I have chemotherapy, and I tell them about, all the benefits of physical therapy too. So it's like, just trying to spread that word, that because I didn't know before. And so it's like, I just would love everybody to know that.
yeah. Yeah, shout it from the rooftops, right? And I think what you said, Cheri, is so important. We can emphasize it doesn't have to be wait till you have courting or because I have this certain thing. It's that I'm going through this and this treatment overall will impact my entire body. And I want support through physical therapy as I go through it, right? But it doesn't have to be one specific injury or thing to look at. It's overall wellness. Yeah. Again, we come back to supporting the terrain, treating the terrain, because that's what gives us the quality of life,
Right.
right?
Yeah.
And
Yeah. And I think
so,
the more we advocate for that ourselves,
mhm.
that's where the strength is gonna be. We need the numbers.
Yeah, well,
Right?
that's
I
true,
mean,
right?
we're
That's
so
an important thing to address, though, and say, because it's like a while ago, I did a podcast because I work with some nonprofit agencies and they offer grants. But women talk themselves out of applying for the grant money because they feel like I'm taking it from somebody else. It's like, if you guys don't apply for the grants, then the people who donate the grant money will stop donating it because they're like, it's not doing any good. Right. So when we have insurance allowing us access to physical therapy and we're not getting physical therapy or asking for the referrals, then how long will we continue to have that wonderful benefit of being able to access physical therapy? right? So yes, use it,
Mhm.
right?
That's right.
Show the value that it has, 100%. Yeah.
Yes. So thank
Well,
you, Laura, for
thank
doing this too.
yes, thank you. And anybody who lives in Duluth, I'm going to put Monica's contact information. You guys need to head on over and ask your doctor if you can go see her. So, Monica, Cheri, thank you so much. I really think this information is just so incredibly valuable. And again, you know, in a cancer diagnosis, and Monica, you said it so beautifully, right? We get thrown into the spin. There's a tremendous amount of fear. The standard of care, conventional medicine, is a fear-based system. And we don't know that there's so many things we can do that empower us to help ourselves to feel better beyond surgery, chemo, and radiation, right? But there are so many tools.
Yeah, you said it, Laura.
Okay, friends. If that doesn't motivate you to check out physical therapy, ask for a referral, see how you can be helped, I don't know what will. Physical therapy is that it is a therapeutic healing modality, and it can offer so much relief for us. So I hope that you've heard a nugget, a kernel in this episode that maybe you needed to hear to support you in your ability to feel comfortable and pain-free, or as pain-free as possible, in your body, and to seek out the support that can help get you there. All right, friends, thank you so much for listening. If you need more support with your metabolic health or your mindset, come to my website, thebreastcancerrecoverycoach.com, where you will find my metabolic health and mindset membership, Better Than Before Breast Cancer, and many of my standalone programs that you can do yourself in your own time that can support you in working on your mindset around the life you want to create, around the health that you want to get more connected to, and in understanding different things from nutrition to really managing the very short 168 hours that we have in every week of life and how to make the most of them so your life is full of the joy you want to create. All right, the breastcancerrecoverycoach.com. Do what you need to do to have the happiest life, a life that's better than before breast cancer. And I'll talk to you again next week. Take care.